Assalamualaikum and a very good day to our beloved viewers. My name is Nick Vice and I will be the presenter for this episode. In today's video, we will look into the topic of how to open our school during this COVID-19 pandemic. Since MCO initiated on March 2020, every sector in Malaysia are forced to close, including education sector. The circumstances of this action affected severely on students, teachers and even parents. Students who are less fortunate are forced to adapt to the demanding technology needs, just so they would not be left behind. As parents, responsibilities are to supply the necessity to allow their children to study online. With the already demanding economy, more pressure on the parents. This situation is currently affecting the mental health of many families in Malaysia. We would like to take this opportunity to promote Mercy's hotline that assists people on their mental health issue, especially during this MCO. Do call 03 2935 9935. There are many issues that affecting both students and teachers. They are the availability of the internet access, today's gadget price, teaching pedagogy and materials, cost of internet itself, retaining attention from the student, teachers' app competency, homeworks, and absenteeism. As we move forward, time is not stopping nor slowing down for the virus. The student and teacher are forced to proceed to catch up with the subject syllabus and national exam like SPM. Here are some guiding principles that will provide some planning for the education sector moving forward. These considerations for schools are intended to aid school administrators to consider how to protect health, safety and well-being of students, teachers, staff, their families and communities. Firstly, the school must promote behavior that could reduce COVID-19 spread, maintaining both healthy environments and healthy operations. Also, the school needs to always be prepared when someone gets sick or having the symptom. When we assess the risk involved in education activities, we can split them according to risk. Obviously, the lowest risk option is for students and teachers that engage in virtual-only classes, activities, and events. The moderate risk is where the class is small, in-person classes, activities, and events. Group of students stay together with the same teacher throughout and across school days, and groups do not mix. The highest risk is when the class is at full size, in-person classes, activities and events. Students are not spaced apart, share classroom materials or supplies, and mix between classes and activities. The school must be familiar on the general readiness assessment to ensure the safety of everyone in school. There are policies and procedure, facilities and supplies, education and training, communication and messaging, and lastly, gatherings, visitor and events. Here are the detailed action plans that can be practiced as proposed by CDC. On the issue of maintaining healthy operation, the main purpose is to protect the staff and children which are at higher risk for severe illness from COVID-19. This can be achieved by regulatory awareness, identifying and small groups and keeping them together, cohorting or podding. The class schedule need to be arranged in the alternate or staggered to avoid crowded spaces and unnecessary contact. This type of arrangement could also be applied during travel and transit of students and teachers. In order to maintain healthy environment, cleaning and disinfection must be done thoroughly and frequently. Discourage sharing of objects. The ventilation must be kept in best condition as it will provide better circulation of air. Check water system. Layout of spaces can be modified and can be improved by adding physical barriers. Close or staggered use of communal spaces, and during recess or break time, individual disposables are the best option to be used. The other consideration is to promote behaviors that reduce the spread of COVID-19. Items such as masks and sanitizer should be compulsory for everyone. This type of habit need to be imprinted permanently to everyone's mind as it helps to create a better and prepared society. The most important consideration of CDC that we could adapt here in Malaysia is how to prepare when someone has COVID-19. Firstly, it is important to isolate and transport the students who develop symptoms while at school. This could help curb the spread of the virus. Then, we need to clean and disinfect the affected area. The health officials and close contact need to be notified accordingly to inform them on the actual condition. All students, teachers, staff and criteria must be advised to undergo home isolation and quarantine. To allow for the education sector to open, we need to have better understanding of Malaysia education ecosystem. We will do a comparison between Malaysia and U.S. classroom. As we all know, classroom in Malaysia do not have any conditioner, as we use ceiling fan, whereas in America, most of the classroom using air conditioning system. The windows in Malaysia classroom are always kept open during class session. In the US, due to the heating and cooling needs, the window must be kept closed to preserve the temperature inside the classroom. These conditions only allows a group of 25 students within a classroom in the US, whereas in Malaysia, our classroom can be up to 30 to 40 students. The usage of student locker is only available in the US, but not in Malaysia. In general, we can conclude most of building for school in Malaysia is designed in open condition, but in America, the schools are enclosed designed. Here is an animation of how aerosol behaves in enclosed classroom compared to if the windows are fully ventilated, courtesy of NBC.
Watch how droplets from a sneeze linger in a classroom with poor ventilation. The droplets slowly cover nearby students in a thick but invisible cloud. According to health experts, enough virus could be in this cloud to get someone sick, even 5 minutes after the sneeze. But add in a ventilation system and the particles thin out quickly. Within a minute, they get sucked up by the air intake vents in the ceiling. But some particles are still blown back down. The best scenario? Open windows and doors for fresh air. The outside air dilutes the droplets. Within 2 minutes, there's a much lower concentration of virus inside, making it less infectious.
Recently, Kementerian Pelajaran Malaysia had issued guidelines for school management and operation 2.0 on February 9, 2021, in view of opening the school in March. The guidelines can be accessed from the website link. The objective of this guideline are for management of schools and hostels can be operated with more systematic and smoother, to emphasize on safety and health of students, teachers and workers when they are in schools and hostels. Next, so that the teaching and learning process can be proceed in a healthy environment. Last, to allow a central evaluation and public examination can be conducted in more systematic and smoother. The issues covered in guideline encompasses schools management, infrastructure management, health and safety, management of person with positive COVID, management of close contact with positive COVID person, management of symptomatic person, closing of institution, teaching and learning, parents' involvement. In addition, other matters such as special needs student, sports and curriculum activities, technical and vocational education, public examination, and students' physical fitness standards implementation are also covered in great detail. The guidelines provide similar, adequate controls as per CDC. Since most of Malaysia's schools are not air-conditioned, transmission through airborne can be minimized. Nevertheless, some rooms such as teacher's room, library, office, private school have air conditioning. There is no mention on engineering controls for air-conditioned spaces. We hope our school children and teachers can resume their education safely. Don't forget to hit the like button and subscribe to our channel. Stay safe everyone. Kita jaga kita. Thank you and Assalamualaikum.
Cut.